Good morning, everybody. So as Kevin said, it's a good opportunity. Every week we kind of I spend a few minutes with you and I send some information your way, but we thought it was a good time. It's the beginning of the school year for a lot of people. And so it's a good time to kind of reset and talk about sort of more globally, what are the issues out there? What should you be thinking about as an employer? In some ways, we're in a very different place than we were a year ago. And in some ways we feel like we're right back where we started. Let's talk about sort of generally, one of the hot topics is masks. And as you all know, especially those of you who are MEA members, one of the things we do here at MEA is we run a hotline run by our fabulous HR advisor, Jane Disher. And so we get a real good sense of what our members are thinking about. And we're getting a lot of questions about masks right now. In many ways, it was easier when there was a mask mandate in place, right? We all knew that we all had to wear masks, and there still is a mandate in some places, but less and less now. And as a result, as Kevin talked about, it gives us a lot more discretion as employers. And sometimes that discretion is a great thing, but sometimes that discretion can be very challenging. And a lot of times what that ends up doing is it turns our managers and our employees into police officers, right? And that can be an uncomfortable place to be, especially if you're a business that deals with the public. If you try now to enforce a mask mandate when your state or your locality does not have that mandate in place, what are you asking your employees to do, right? What are you asking your employees to do with regard to the public? We've heard some of the terrible stories of employees getting attacked verbally or physically for asking people to wear masks. And we don't want to put our employees in that position. Similarly, even if we're not open to the public, we don't want to put our managers in the position of constantly having to remind people, pull up your mask, put on your mask, et cetera, because one of the things that's happened over the last few months is that the CDC said, a few months ago that we didn't have to wear masks if we were fully vaccinated. And so a lot of us started taking our masks off, and we got very comfortable with that. And it's psychologically difficult to ask people to go back. But just recently, CDC again revised. So on May 13th, like I said, there was a guidance that said that fully vaccinated individuals did not need a mask in most situations, right? But now CDC is saying, well, we've got this Delta variant, cases are rising, hospitalizations and deaths are rising. So CDC is now recommending that even fully vaccinated individuals resume wearing masks indoors in areas of high or substantial community transmission. And if you look on this, the CDC has an interactive tool on this. You can go in and you can look at your county to see if you are an area of higher substantial community transmission. And pretty much everybody in the Delaware Valley is. I think every county in the Delaware Valley is. So again, you need to be thinking about, as an employer, what do we do around masks? Now, I've talked to some of my manufacturing members. They never stopped wearing masks. And in some ways that's easier, right? Because people didn't get the taste of the freedom without the masks, and you have to ask them to go back. But one of the things to think about with masks is, what is the danger zone, or what is the danger threat within your organization? And you all need to be thinking about your own individual risk, right? Now, the guidance for unvaccinated individuals never changed. They still need to be unvaccinated individuals. Always were supposed to be wearing masks indoors, but of course we knew that really didn't happen a lot after May 13th. Philadelphia, as I'm sure you all heard in the last few weeks, they said that businesses and institutions that don't require everyone who enters to be vaccinated will require masks for everyone on site. But sort of generally, if you're not in Philadelphia, if you don't have a mandate, what should you be thinking about? Well, these are some of the issues to consider. Should everybody mask? Or should you just have your unvaccinated employees mask? And of course, that goes to the issue of tracking vaccination, which we're going to talk about in a little bit. Where should people have to wear masks? Even back when we had a masking mandate, we were told pretty much if someone was sitting alone in a private office, they didn't need to mask. So that's pretty safe. But what about in a room with two people? How big is the room, right? What about, I've gotten calls from members that say, we've got this several thousand square foot warehouse and we've got 10 employees in it. Do we really need to have them wear masks? So you need to think about what's your social distancing ability within the workplace as well. Should it be mandatory or voluntary? Some people never wanted to take their masks off, and that's fine. We should always let employees continue to wear masks if they want to. And then what about for visitors? Are we just having our employees wear masks? Are we having visitors wear masks? I know I've gone into a number of retail establishments and restaurants, and you'll see the employees working there all wearing masks, but they're not requiring it of the patrons. Is that a possibility? Is that something that you want to do? But yeah, you're thinking about how easy it is to socially distance. How much interaction do your employees have with the public? If you're a private business that doesn't bring the public in, that might be a different discussion. Again, what percentage of your workplace is vaccinated? One of the things we talked about several months ago in our town halls was we can look to the professional sports leagues. They've done some interesting things around this. They have said they set different rules depending on what percentage of your team is vaccinated. So I think the threshold generally is about 85%. If 85 to 90% of your team, and when they say team, it's not just the players, it's the coaches and the managers and the people who are around the team on a regular basis, the trainers. If you get to a certain percentage of vaccination, your rules get relaxed. And so that's part of the carrot and stick discussion that we're going to have in a little bit. But that may play into it as well, because what we know, and I know there's a lot of discussion about vaccines. We know that people who are vaccinated can still spread COVID, right? But we also know that people who are vaccinated are much less likely to get severely ill, much less likely to be hospitalized, much less likely to die. So you're thinking all about risk assessment, right? That's largely what employment law is. It's about risk assessment. I get this benefit, and what detriment do I get as a result of it? So if you have a high level of vaccination within your workplace, you're probably feeling a little bit better about relaxing your masking requirements or your mandates. So something to think about. And then also, are you requiring regular testing? And we'll talk about that in a little bit as well. That can influence the decision as well. If you're regularly testing employees, you're going to have a much better handle on who's positive and who's not, and that might guide you with regard to masking.
Amy, and I think these are great topics, things to be thinking about. We will do a poll in a minute, but anyone that wants to type in a chat about how they're looking at these and using it internally, that'd be great to do. I know we're going to touch on this later, but I think one of the big factors to me as an employer when I think about these things is that quarantine standards, which we're going to talk about. And I think that gets into, well, how many people are vaccinated, because there's a different quarantine standard for your vaccinated employees. Because, when you have somebody that does have to quarantine, we still have, that kind of 10-day period, which Amy will touch on. And so as a business leader, that's in my mind all the time is like, well, if something happens, how many of my employees will be impacted like that? So these are very interesting. So we are, let's see, we've got a comment that was put in by someone, said, they're looking for a copy of they get a copy of the vaccination. The question is, without actual documentation, should we just consider having them as unvaccinated? So someone wasn't willing to give the documentation.
Yeah, I mean, what we've always said to our members is, and this becomes a concern because you ask for proof of vaccination, and you're having only vaccinated employees go without masks, the unvaccinated go with masks, and becomes a concern. Well, aren't we making a clear distinction then who's vaccinated and who's not? And the way I answer is this: the people who, if that's what we're doing in the workplace, if we're going to make a distinction between vaccinated and unvaccinated with regard to masks, the distinction we should make is the people who are continuing to wear masks are people either who want to wear masks or who have not given proof of vaccination, right? It doesn't necessarily mean you're unvaccinated. It means either you're making a choice or you have not given proof of vaccination. And that kind of allays some of those concerns. But yeah, that's how I would approach it.
And that's a good point, Amy, too. I mean, I think as we all go to stores and grocery stores, whatever, we see probably a higher percentage of people wearing masks than we did a month ago with the Delta variant. And I think having a workplace that supports people's choice to wear a mask, whether they're vaccinated or not, and making it not uncomfortable for someone to feel they need extra protection, I think is also a really good thing. So, and again, I like what Amy just said about saying, we support you wanting to do what you're comfortable with. And if you don't want to tell us, that's okay. You wear a mask if you're not vaccinated, or if you just want to wear it, taking that stigma of a mask represents something versus it's about, kind of what your status is and what you're comfortable with.
And kind of remember that we're dealing with a couple of different things here. One is that you have an overriding responsibility as an employer to provide a safe workplace. So that plays into your mask discussion. You also have, as Kevin's talked about, and we'll talk more about, quarantine periods and isolation periods. You need to be able to run your business. So the more people who get sick, the more people who get exposed, the more people who have to isolate or quarantine and can't come to work. If you're the kind of business where people have to come to work to do their job, that really affects your business. That impacts your ability to continue to run. We saw that a year ago. Last summer, we saw a number of manufacturing members have to shut down departments because they did not have enough employees to run the departments because people were either sick or they were quarantining. So considerations as well.
Someone asked a question, Amy, that what do they do with a population that won't observe the basic distancing, you know, the 6 feet, 10 minutes, 15 minutes. What are your thoughts about that?
I mean, you have a decision to make as a business, right? We all decide as managers, as business leaders, what's important enough to discipline people over. Is this it, right? And if you're going to do that, you're going to need to do it. You're going to need to announce the rule, tell what the consequences are, and consistently enforce the rule. It's the same thing with masks. If you're going to have a mask requirement and people aren't going to wear them, I've had HR managers tell me consistently, yes, we have a mask mandate, but no one will wear them and there's nothing I can do. Well, yeah, you can, but you've got to make that decision, that business decision, that cultural decision, that we're going to take this really seriously and we're going to start disciplining people who don't do it. And then you need to be prepared at some point, maybe to terminate people who don't do these things. And that, again, that's something you need to think through ahead of time if you want to go down that road or not. But that, if you really want to get people to take it seriously, that's unfortunately the way to do it.
And Karen asked a question, do we still have quarantine guidelines without regard to masks, close contact, but wearing a mask? Amy and I were talking about this before we got on the call, because there's no distinction about quarantine requirements if you have to wear a mask, which somewhat doesn't kind of promote the use of masks because it's not getting you out of the close contact discussion. But again, that's where the law stands at this point, or the regulations stand at this point.
Yeah. The close contact definition doesn't care if you wear a mask or not. So, which seems a little counterintuitive to me, but CDC has never made a distinction between masked and unmasked. It's that close contact for 15 minutes over a 24-hour period. And we are going to talk more about quarantine periods in a minute.
So someone has an interesting question, which I haven't heard this one before, Amy. It's if you have an employee that is medically exempt from both the mask and the vaccine due to risk factors, what can you do to protect this person? And then the suggestion was maybe require masking for everyone who interacts with them. I'm interested to hear what you say, and I'll give my thoughts. But
I mean, there's a couple of things. I know that we all we want to reasonably accommodate people, right? And as an employer, it's important to follow ADA around reasonable accommodation. But there may be some people we can't reasonably accommodate. I think we need to remember that. We need to go through an interactive process. So you want medical documentation that shows that they can't get vaccinated, can't wear the mask, all those things. But you ultimately can decide as an employer, and I wouldn't decide this alone, decide it with your employment attorney, that the person poses a direct threat either to themselves or someone else, and that the threat of them getting sick in the workplace or infecting others is too high. And therefore, we can't have this person in the workplace. That is an option. You go down that road. Another option is, anybody in that department is going to be wearing a mask. Or anybody in that department is going to be socially distancing, or, we're going to put up plexiglass. We're going to do all the things that we were doing a year ago. There are different options and different things to think about, but it is an ADA reasonable accommodation discussion. And I suggest that you go through that process with the help of an employment attorney.
Yeah, and I do think you probably want to really look at how you're going to separate that person out in that situation. Again, obviously virtual would be the best, easiest choice for someone's at high risk. John, thanks for your input there. So John is with a large manufacturer. They took the mask requirement away and recently have put it back in place, except for what we talked about, some areas where you can assure social distancing and so on. So I do think that disruption of business is a big factor to think about, and and your ability to keep people socially distanced while they're working. Well, we'll keep looking. Thanks for all the comments. These are great. We'll keep moving ahead, and we'll try to keep an eye on some of these and try to bring them in.
I think this is the right time to run our mask poll. Ben, if we could pull that up. We're just curious as to what you all are doing right now. Are you requiring masks in the workplace? Yes, for employees only. Yes, for everyone, including visitors. Yes, but only for unvaccinated individuals. No, or we're still thinking about it. We haven't decided yet. So go ahead and vote. We'll wait a minute or two and see what the results show. Okay, interesting. So yes, for employees only, 7%. Yes, for everyone, including visitors, 39%. Unvaccinated only, 28%. No masks, 22%, and undecided, 3%. So a little bit all over the board, but the majority are saying for everybody, followed pretty closely by for unvaccinated individuals only. So interesting. Okay. All right. So
Amy, there's one question
yeah.
that's interesting. I'm trying to look for interesting ones here that are not that we haven't normally heard. Someone says if someone hasn't submitted vaccination card, they ask them to fill a form out basically saying whether or not they've had it, but also if they haven't gotten the vaccine, asking the reason why, and some of the reasons being medical, religious, not comfortable with data, et cetera. I haven't seen that before. What are your thoughts about that?
Yeah, it gives me a little bit of pause as an employment attorney. What EEOC has told us is we can ask our employees, have you been vaccinated, yes or no? And we can ask for proof of vaccination. And we're going to talk about this in just a second. But you really should not be asking the reason why, unless if someone is looking for an exemption to a mandatory vaccination policy, they can go the route of asking for a religious or a medical exemption. But once we ask, are you vaccinated or not, we should not really be asking why. So I would caution against that. Probably again, review that form with an employment attorney.
And I, following along, but it is okay to continue to provide education information to folks, encourage them to get vaccinated. There's no reason you can't continue to try to convince people to do something. And we're going to talk about mandatory in a little bit. But so instead of asking the why, you might want to turn it into, well, here's some information for you.
Yeah, and let's talk about incentives as well. So that's our next topic. So I think it's pretty well established at this point, employers can require the vaccine as long as it's related to a legitimate health and safety reason. Oops. So for example, you have a workforce that everyone is working virtually. You probably don't have a great reason to require everybody to be vaccinated. But if you have employees who are all coming to the building, especially people who interact with the public, you're probably in pretty good shape to be requiring the vaccine now. And of course, the legal challenges will continue, but so far the lawsuits have gone in favor of employers. There was the big one down in Houston, the large hospital chain where they mandated the vaccine. A federal judge decided in their favor. You also saw a large state university, Indiana, required students and employees to get vaccinated, and a judge has decided in their favor. So far the lawsuits are going in favor of employers. Stay tuned, of course, but so far I think for the most part those lawsuits are going to go in favor of employers. Of course, you have to allow for reasonable accommodation, interactive process. With regard to disability or religion, doesn't mean though, just because someone has a medical exemption or a religious exemption that you have to grant the exemption. Again, you go through an interactive process, just like you would for any ADA or Title VII accommodation process. And at the end of the day, you have to make a decision as to whether or not you can accommodate that person, or are there any other options? And also, interestingly now, the impact of full FDA approval. I think a lot of employers were hesitating previously because they said this was still under an emergency use authorization, the vaccine. But now we've got at least one of the vaccines has full FDA approval. I think more and more employers are going to feel like they have better, more solid ground to stand on if they're going to require the vaccination. And you really need to think about it. Are we going to mandate, or are we going to make it voluntary? As Kevin said, if you're going to make it voluntary, there's a lot of great things you can do around education and making it as easy for people as possible. And I'll get to that in a second. But I think the first thing to think about, if you really are thinking about mandating vaccines, and I've had this conversation with several members, it's the what then, right? If you have employees who refuse to take the vaccine or refuse to get vaccinated, what are you going to do? Well, you're requiring them to get the vaccine, you're going to fire them. Are you prepared to do that? And especially you're prepared to lose 20, 30, 40% of your workforce over this issue. Keep in mind, you have the potential for legal challenges, including workers' comp challenges. It seems that if you make the vaccine mandatory and someone has an adverse reaction, that is a workers' comp event. So you might want to have that conversation with your workers' comp carrier. And also the legal challenges, like I said, so far, those have been going in favor of the employer, but do you really want to go down that road? Because even winning an employment case is expensive and time consuming. So is that something you really want to be thinking about? But if you are going to go mandatory or voluntary, I highly recommend that you implement a policy. Let your employees know where you stand, even if it's just that we're going to encourage voluntary vaccination. And how are we going to do that? Anybody who's been on these town halls with me for the last year or so know that I favor a carrot approach versus a stick approach. Educate your employees. There's still a lot of people out there who have a lot of misinformation around the vaccines, around the safety, around the efficacy. You know, people say, well, I can still get COVID even if I've gotten vaccinated. What's the point? Well, the point is, based on the data that we're seeing, is that you're much less likely to be hospitalized, much less likely to die if you have been vaccinated. So the more that you can get education to your employees around these issues, I've seen employers do town halls. Some employers have access to healthcare professionals who they can bring in to do those town halls and have those discussions. And that can be really helpful. Make vaccination as easy as possible. Generally speaking, it is free. Either the insurance is paying for it or the government is paying for it. So that should not be an issue, but make it as easy as possible. Can you do a vaccination clinic in your workplace? Talk to one of the pharmacy chains, see if they are willing to come in. Do you have enough people who would sign up? If you're not going to do that, give people paid time off to go get vaccinated. Give people paid time off to recover from vaccination should they have any adverse reaction. Could you give other benefits or could you do bonuses? Some employers have. I would not give a very large amount because I think that could create a wage and hour issue for you, but could you give, a $25 Wawa gift card? Sure, I think so. EEOC has not weighed in on those yet, so I would keep the bonuses on the smaller side, but think about if it's something that you could do. Are there other benefits you can give to the vaccinated? Only vaccinated people can come physically to the office. Only vaccinated employees can travel on behalf of the employer. Only vaccinated employees can go on certain client visits. And that, really makes it a good time to review your job descriptions because you want to have it in the job description that someone needs to travel for their job or someone needs to go on client visits. Because what can end up happening here is people who are unvaccinated are not going to be able to do those things. And as a result, you may ultimately have to part ways with them. So take a look at your job descriptions now around this vaccination issue as well.
Okay, let's throw a couple of questions in the mix here. Thank you for all the comments and thoughtfulness. It's great. Good question here. Would advertising the sales or service department is 100% vaccinated to customers violate any kind of privacy requirements?
I don't think so, because it is it's an aggregate. So I don't think so. I probably would have that discussion with your employees and say that we'd like to do this. Is anybody uncomfortable with it? I think we're going to see it regardless. I think we've already seen it. There have been some restaurants, for example, that have said that our staffs are 100% vaccinated. So yeah, interesting question. And what I continuously say in all this is we don't even know the lawsuits that are going to come down the pike. So, consider every issue sort of from a cost benefit analysis, but I don't think so.
Yeah, and it feels like there's certainly the sentiment across the country is in favor of vaccination and protection. So I think if you're going stronger that way, I think your risk is lower, even though no one can say that with certainty. Like Amy said, there's a lot to come, but it'd be hard pressed to see how you'd be isolating yourself in that standards. Question here, if we don't follow the current CDC guidelines, and again, I think we should re-emphasize recommendations versus requirements. Do we have any additional liability if a person gets ill? Can someone claim we didn't do our part to create a safe work environment?
Yeah, I mean, I've been saying this since the beginning of the pandemic. Your safest route as an employer to say that you provided a safe work environment is to follow all CDC and local guidelines. That's your best argument around around your argument that you've provided a safe workplace. If you're not going to follow CDC guidance, if you're not going to follow local guidance, what's your really good business reason for not doing that? So things to be thinking about, definitely.
And right now, just to remind me, Pennsylvania does not have any workplace standards. And New Jersey, are they all masks inside everywhere, or?
New Jersey has flipped on this a couple of times, so I have to say that I don't know what the current is in New Jersey if they're requiring masks inside right now. They had dropped it for a while, but having spent some time in New Jersey over the last couple of weeks, for the most part, you're seeing employees in stores and restaurants wearing masks.
Okay. Someone going back to that individual that can't get the vaccine and maskless, if they can't accommodate that and the job can't be virtual, is that a basis for termination?
It is. Now you have to go through that interactive process. You've got to gather medical information. You've got to have a back and forth conversation with the employee, just like you would under any other ADA or religious accommodation issue. But you can ultimately make the decision that, yeah, we can't accommodate this person any possible way, and therefore we don't have a job for them. Again, that decision is not without risk. So I sound like a broken record. I would make that decision with an employment attorney. But yeah, you can ultimately make that decision that we don't have a job for this person because it's what ADA calls direct threat. They're either a direct threat to themselves or others, and you can't mitigate it through accommodation.
Yeah. Okay, and someone asked a similar, do we have any guidelines or questions for what to ask around a religious exemption? And again, I think this is another one that you would want to include employment counsel in the.
Yeah, definitely include employment counsel. I have had this conversation with a few different members, and what I've seen members do is they start to challenge the religious belief. It's very hard to challenge someone's, it's a sincerely held religious belief under the statute. You're not going to be able to do that because even if you point out, someone says, I'm Christian and therefore I believe, et cetera, and then you say, well, the Pope's been vaccinated. That doesn't, generally speaking, fly. So I wouldn't worry about that piece of it. I would worry about the back end piece of it, which is, can we actually accommodate this? Which is what we were just talking about before. Maybe we can't accommodate an unvaccinated person in the workplace. So yes, I would have that conversation with counsel. There are forms out there. I'm not sure. I don't know if we have them on member tools or not, but there are certainly forms that you can use to ask for religious exemptions or have your employees ask for religious exemptions. I think we have it in our vaccination policies that we offer up.
So if you're a member of a question, you can call the hotline and we
Yeah.
can help find that.
Yeah, we can definitely help you with that.
Someone, going back to your job description. So what type of things would you see in a job description? I think clearly one of those would be somebody whose job requires them to travel to clients or prospects. Mm-hmm. Because again, that's a very fluid, what people are we're going to ask a poll in a few seconds about we talk about visitors. So that would definitely be one of those. I think close contact with people, like a job that's in health services, obviously, but anything where there's close interaction with the public or customers.
Yeah, absolutely.
You're trying to show the safety and the need for this.
Right. Also, yeah, you're just trying to show if I have an employee who or if I have customers who only allow vaccinated individuals to come into their workplace, therefore I as an employer can only send my vaccinated employees into their workplace, and that is essential for them to do their job. We were talking before we got on the call, think about a pharmaceutical sales rep who has to go to doctor's offices. If those physicians are only going to allow reps who are vaccinated into their workplaces, well, if you as my sales rep can't go into that workplace because you're not vaccinated, I don't really have a job for you anymore. So you want to put that into the job description, must be able to visit doctor's offices, for example.
Yep. There's a few questions about the Delta and health insurance. We'll hold that off because that's going to come
up we've got that. Okay.
Yeah, we're going to cover that one in a second. And I think someone asked about carrots and convenience aren't working anymore. So let's talk about some of the sticks that we're seeing.
Talk about sticks. Yeah. I was encouraging carrots, very much so at the beginning of all this. It may be time to move to sticks. I don't know. But we certainly see various governments doing this. New York City and New York State, federally, Department of Veterans Affairs, California, federal government is requiring it. And we just saw in the last couple of weeks, President Biden ordering the Department of Health and Human Services requiring nursing homes to have vaccinated staff for them to get Medicare and Medicaid funding. So that should be an interesting shift with regard to nursing homes. And then we also are seeing it in private industry. And this is the interesting one that I think that a lot of people are talking about is this third bullet point is Delta. They added a $200 per month healthcare surcharge for unvaccinated employees. There's been talk for the last several months about, can we do that? Can we make the premiums higher for our unvaccinated employees? And the analogy that has always been made has been smokers, that the premiums tend to be higher for people who smoke. The pushback on that has been, yeah, but we don't have the data around unvaccinated people, that the same data that we do for smokers. For smokers, we have decades of data that shows they tend to be sick more and tend to use healthcare resources more. We don't necessarily have that for unvaccinated individuals. So this is going to be a very interesting one. I am certain that other employers will follow. But very interesting to see what happens there, because I think that the greatest sticks you can have are the sticks that affect people's pocketbooks, right? So do they have to pay more in healthcare? Are they ultimately going to lose their jobs because they're unvaccinated?
And just one qualifier on that, Delta as a large company is undoubtedly self-insuring. So I'm sure they've gone through some actuarial analysis to say there's a higher cost of care. If you're not self-insured and you're using fully insured, you're probably not going to be able to make that difference because you're not paying more. Your healthcare is covering it. So I think I think what Amy has said throughout the pandemic is let the big boys go blaze the trails on some things like this and follow behind. And these are really interesting to see what people are doing. I think it's giving us a lot more, comfort that you could do a mandate if you feel that's appropriate. I mean, somebody on my peer group back in May said they were doing a vaccine mandate. And I think most of us in the group were like, wow, that's seemed very unique at that point. Now it seems a lot more common. So, don't be first is still, I think, good logic for most of us to take a look in this space, but it's certainly good to see where trends are going for sure.
Yeah. And then I think this Ladders study is really interesting. They reviewed almost 4 million high-paying career job postings in the US and Canada over the last couple of years, and there's been a surge of more than 5,000% in job postings listing vaccination requirements since 2021. So it is becoming more of a trend, because one thing that some employers are doing too is, I might not require my current employees to be vaccinated. I might not have a mandate for current employees because I'm too afraid that people will walk out the door, but I may require it for all my future hires. So something to think about as well. And then this other question that has already come up, can we ask people if they've been vaccinated? Yes. And I think, yes, you should. I don't think you should rely on the honor system. Think about how many employees lie to you about so many things. Get a copy of that vaccination card. Now, it is I believe it's a confidential medical record. It should be kept in your confidential medical file. HR largely should be the only one who has access to that, except anyone else who has a real good business need to know. But again, we should only be asking for, have you been vaccinated? Yes or no. If people say no, it's not a why not question. We don't want to elicit medical information because that would violate the Americans with Disabilities Act. And keep in mind that it is an ADA issue. It's not a HIPAA issue. So many employees say, you're violating my HIPAA rights. They don't actually have any HIPAA rights in most workplaces. So, but maintain those vaccination records as you would any other medical information, a separate medical file. So the place you keep your FMLA, your workers' comp, all that stuff. And of course, check state law requirements. Just make sure, and I hope here in the Northeast, we don't have to worry about that, but there are other states that have been a little wonky about vaccine mandates. So just want to make sure if you have employees in some of those states that you're not running afoul of any state laws.
A couple of vaccine questions. I know we're running out of time, so we'll try to be quick. We do, by the way, I was told we do have a sample employee vaccination policy in the member tools, both the mandatory and voluntary version for members to take a look at those. Is there a way to validate if a vaccination card is real? I know there's a lot of talk about that out there. I don't think we at this point have any, special information other than the physical looking at one. But One that did come up here, though, is all the talk is about vaccinated. What about those that have recovered from COVID and supposed to have the antibodies? Are there any case studies that support including them in the vaccinated status? I think there's a lot of debate out there about this. I think from an employment perspective, what I would say is you're driven completely by the CDC and the state health. And until one of those two say something, I wouldn't factor those studies or research into the mix.
Agree.
So here's a good question. What are your thoughts on withholding an across the board wage increase to those that aren't vaccinated? It's an interesting issue.
Yeah, it is interesting. Stuff like that always makes me cringe a little bit as an employment attorney. But yeah, I mean, it's not, carrot and sticks, right? I think it is something that you could think about. Now, again, you need to be prepared as soon as you do that, how many people are going to quit. But I would, if you're a member, let's talk about that. Let's talk about individually how that plays out in your workplace.
What about this, Amy? I just thought about this in response to what about if you expanded PTO for somebody that's vaccinated who's required to quarantine, but you don't expand PTO if you're not vaccinated?
Yeah, I've heard that also. I've heard that as a possibility as well. Again, there's certain things as an employment attorney that make you cringe a little bit, but you don't have a really good legal reason for them. So it does concern me a little bit about how does that play out and how do we implement that? And how does it end up looking discriminatory in any way because certain groups of people get disproportionately affected by that? But yeah, I mean, I think it's a possibility that you should talk through with an employment attorney.
Yeah, I think all these are seeing how far we can go up to, but not to the mandatory.
Right.
And I think that's
we're not terminating. What other things can we do? Right. So I think this is a good time to do our vaccination poll about whether or not you are mandating vaccines. This is a simple one. Are you requiring employees to be vaccinated? Is this a mandatory vaccine policy? Yes or no or undecided? All right. For the most part, no. For the yes, 8%, no, 81%, and still undecided, 11%. So interesting. Not surprising to me. I don't think most employers are mandating at this point. Then think about COVID testing continues to be an issue. Could we or should we require regular testing for employees, for all employees or just unvaccinated employees, maybe just for travel purposes? What kind do we use? Keep in mind, if you're going to require testing, you're paying for the testing. Keeping in mind, if you are requiring testing for your non-exempt, your hourly employees, that probably is work time. So I know that we think that the testing might be a great option, but it comes with its own issues as well. So think about that. And again, what type of testing are you doing? There are the self-tests at home, I think are now a thing. So maybe you use that, but I don't know that they're as reliable as some of the other testing that is out there. And then finally, because I know we're getting close to time here, these are the slides that I think, and again, we will offer the slides after this, but this is sort of the latest and greatest with regard to quarantine and isolation. So these are the things you should be thinking about. If you haven't looked at your safety policies in a while, maybe update. So there is a difference between quarantine and isolation. Quarantine is for someone who's been exposed to COVID. This is for someone who has had close contact with someone who has COVID-19. Close contact, as we know, is defined by the CDC as being within 6 feet of someone for a cumulative period of 15 minutes or more over a 24-hour period. For unvaccinated, you need to quarantine following that close contact. Fully vaccinated don't need to quarantine after close contact, but unless they have symptoms, but they should get tested 3 to 5 days after their exposure, even if they don't have symptoms, and they should be wearing a mask when they're around other people for 14 days following exposure or until their test result is negative, okay? Quarantine period originally was 14 days, as we remember. CDC lowered that to 10 days, and they also added a testing option several months ago. So you can stop your quarantine after day 7, if you receive a negative test that is 5 days or later from your exposure. So that's the latest and the greatest from CDC around quarantine.
And then that last one, just to clarify, is that both for vaccinated and unvaccinated on the 7 days?
How long that needs to be? Yeah.
Yeah. Okay.
Okay. And then isolation is for people who actually have COVID, confirmed or suspected. And that isolation period has not changed in a while. It's 10 days since symptoms first appeared, or 10 days since your positive test if you have no symptoms, 24 hours with no fever without using your fever reducing medications, and your other symptoms are improving, recognizing that some of those symptoms, that taste and smell, for example, may go on for weeks or months. Okay, so that's my gift to you, those 2 slides. I got you the latest and the greatest from the CDC. So what should employers do? We want to do everything we can to encourage sick employees to stay home. FFCRA was a voluntary expansion through the end of September. I have not heard anything that leads me to believe that it's going to be extended further. You as an employer can certainly make a decision to expand PTO. And we're going to ask that poll question in a second, but what do you do? Do you require a negative test to return? Again, you're going to have to pay for that test as an employer. Do you require a doctor's note to return? CDC and EEOC have been discouraging us from requiring doctor's notes. It's an added expense for employees. It might be hard to get into a healthcare provider, et cetera, et cetera. You're probably better off just following CDC guidance as best you can. But let's ask that poll question now. What are you guys doing around PTO to encourage sick employees to stay home? Have you changed your PTO policy to encourage sick or exposed employees to stay home? Yes, no, undecided. And if you've done something really interesting or different, we'd love to hear about it in the chat.
Amy, while they're filling that, one question came in. Company has nearly 90% of employees vaccinated. Because of this, I guess they're still doing the daily acknowledgement that I don't have the symptoms and so on. What are your thoughts?
Yeah, I mean, I think a lot of employers have dropped that. It's no longer a state requirement. So I think a lot of employers have dropped that. Again, it's all a business call, right? I think the message we want to give as employers is, if you don't feel well, please stay home. And we want to encourage that every which way we can. If we think the only way that we can remind employees is by giving them the daily symptom tracker, then continue to do it.
And I think this relates to this. Somebody said they voluntarily continue to. Are you going to talk about FFRCA still, or did I miss that?
I mean, I've just talked about that it's set to run out in a month, and I don't think it's going to get extended.
You don't think it's going to get extended? Okay. Some people seem to be saying they're using the voluntary FFCRA concept. Is that still permitted too? So extra time for someone that's in one of the categories, but you're not going to get reimbursed by the government.
Right. Yeah, you can do whatever you want around this. Remember, PTO for the most part, especially if you're not in California, PTO for the most part is not mandated by law. So employer, and again, Philadelphia, I know New Jersey have their 5 days of sick time a year. But for the most part, you're not required to do anything around PTO as an employer. So you can kind of do whatever you want. So if you want to do something that is FFCRA-like, giving time off to get the vaccine, paid time off to get the vaccine, giving paid time off to recover from an adverse reaction, you can do that. But as Kevin said, you're just not going to get the tax benefit from it. And our PTO results here, 17% have changed their PTO policy to explicitly encourage sick or exposed employees to stay home. 77% say no, and 6% are still thinking about it. Okay, so I guess that's kind of the last thought I will leave you with. This is something we were talking about a year ago. Now, a year ago, when school was starting, many of our employees' kids were going to school virtually. I think for the most part, most kids are going in person now, but who knows? Who knows if that could change? So we really need to think about, can we offer flexibility at work, flexibility around when and how work gets done, flexibility from work, leave and time off, those PTO policies. Is there any way to subsidize care? And what if schools go virtual again? Or what if an employee chooses a virtual option for their kids? These are just all food for thought as we move back into the school year. And how is that going to affect your employees who are parents? All right. That's all that I wanted to cover today. I don't know, Kevin, if there are a few more questions we wanted to try to answer.
Let me take a look. I did just get an alert that said Governor Wolf just mandated masks for children K through 12 in schools. So that's one of those topics that has been very sensitive because it's been left to the county or school district level. So that,
and even like I'm in Montgomery County. Montgomery County was just recommending. So I saw, I've got a school age kid. So my son's school was mandating them, but another high school was not. So I thought that's interesting.
Yeah, so just, and John, thank you for giving us some input. So again, a large manufacturer is implementing a paid sick leave policy for COVID eligible reasons for employees that provide proof of vaccination. So I think that's the kind of trend you want to think about is, look, we're trying to promote, we're trying to educate, we're trying to get everybody to do something. When you can keep making it more attractive and maybe a little onerous, and that may be on the testing side to kind of promote somebody, kind of doing what you can to all the way up to the mandatory. I think, personally, I think the mandatory is still a little tough to do unless you have a really legitimate safety health reason. You see large companies doing, because when you have 5,000 people coming to an office, it's very hard to manage, even just a few people. But if you, again, can space out and have people that are understand it, I think that, but I think these are great topics and ideas that people had in the notes on a lot of this. Someone said for a future topic, discussion around staff coming back to the office and negotiations around flex scheduling. Craig, that's exactly what our panel is going to talk about at the Total Reward Summit, because we have this concept of hybrid, which is really just an amorphous word for a different way of working. And the conversation we're going to have with this very good group of arch folks is, how do we create some semblance of order and framework, but recognize and acknowledge that everyone has slightly different needs, and that so the theme is flexibility within a framework. And that's kind of, I think, we're going to do that at that town hall. You hear it a lot when you look at the comments here and what people are doing. I think we have great members doing really thoughtful things and caring about both the company and employees, which I think is all of our goals. So appreciate the interactive. This was fun. Amy, I hope you had fun. I thought this was great. So I hope you all have a great Labor Day. We will, like I said, take 2 weeks off and come back strong with some good topics. And we probably throw one of these in again, because I think this is so dynamic right now. And I think this is a good way to address the recommended, not required state that we're living in right now. So again, Amy, thank you as always for your insight and expertise in this area. Members, feel free to call Amy or the hotline if you want to follow up on any of these things we talked about, and we will send out the slides and the recording. Take care.